record on this computer. Okay, so welcome everybody. And welcome Ivana.
Hi guys.
This webinar is conducted as a part of weekly fasting group. We fast every week through WhatsApp. We are an international group, and if you want to join this group, there will be a WhatsApp number of Arik, which is me, the manager of the group, the facilitator, and then it's free, of course, and then you can send me a message and I will happily add you. And today we have very important subject, which is skin and hair on the fasting lifestyle. And Ivana is going to enlighten us about that. So please, Ivana, sorry, enlighten us on this interesting subject.
Okay, well, as Arik said, we're going to be talking about skin, hair and nails, and the issues that come up with these body parts, what causes these issues, and how they're connected. And obviously what we can do to improve the health and appearance of all three. You know, skin issues are becoming so much more common and prevalent in recent years, if you see. And, you know, I listen to Dr. Morse's videos where people write in and present their cases, their complaints. And case after case, people are talking about skin problems, acne, eczema, psoriasis, and so on. So we're seeing an increase in these cases, and especially in young people. And I hear a lot of people, and more specifically women, saying, oh, you know, my skin is so sensitive, or, you know, I really don't sweat. And ironically, when they say this, they kind of say this with a hint of coy pride, as if it's a good thing. You know, because unfortunately our society has brainwashed us to think that vulnerability is an attractive quality in women. And femininity is mostly considered attractive if it's small, dainty, pretty, and always smells nice, when it doesn't have any offensive bodily functions or odors. So having sensitivities and not sweating somehow now automatically implies that a woman is more sexually desirable or attractive, because being so delicate and so clean is a testament to her femininity. In my opinion, it's sort of a perverse way of fetishizing weakness and glorifying unhealthy conditions. You see, in reality, sensitive skin is simply weak skin. And skin that doesn't sweat is far from clean. In reality, it's skin that is closed and is not performing its vital functions. Because if you can't sweat, all the garbage stays inside, damaging your cells and negatively altering the function of your organs and glands. So these toxic ideas about femininity aren't just harmful to the psyche, but to the physical health as well. Now, of course, that is not to say that there aren't toxic preconceptions about masculinity, because both men and women are affected by skin issue, though this is mostly on psychological level, because instead of recognizing skin problems as symptoms of a serious internal imbalance, we view them through the prism of vanity. And I myself am guilty of this. When I had serious skin issues, you know, I would be afraid to leave the house. I didn't want to be seen. So we're conditioned by our culture that we have to be perfect, look perfect, to be acceptable to the social group. And, you know, we're so obsessed with stopping perspiration, which is portrayed in commercials as something that's awful and shameful. So we douse ourselves in toxic perfumes. We use heavy metal-laden antiperspirants that block our sweat glands. We also inject neurotoxins like Botox into the sweat glands and even have them surgically removed, which is insanity. And I believe the doctors who participate in this type of idiocy should lose their licenses because they're willfully and irreparably harming their patients. When you have acne, eczema, psoriasis, loose wrinkled skin, stretch marks, irregular pigmentation, when you bruise easily, when your skin is overly dry or oily, when you have dandruff or fungal infections, these are all signs of internal toxicity or acidosis. First, it's important to understand that skin is not only the body's largest organ, but largest eliminated organ. It's actually the body's third kidney. It's estimated that on average, skin expels about 2.5 pounds of toxic waste daily. 2.5 pounds. That's a lot of waste just to come out through the skin alone. The body gets rid of digestive waste through the colon, cellular waste through the kidneys, catarrh through lungs and sinuses, and then gases and whatever else it can get rid of through these specific channels I just mentioned, it will purge through the skin. So if you're having skin issues, and more specifically acne, psoriasis, eczema, rashes, and such, it's a sign that your kidneys are not doing their job. Excessive sweating is also a sign that kidneys are not filtering. But sweating at least shows that there is still sufficient thyroid function that's keeping the skin open. Understand that every single cell in your body is like a tiny machine that is constantly working. It eats for energy so that it can perform its specific functions, and it also creates metabolic waste, just like we do. And a cell is stationary, meaning that it has a fixed position within a gland or an organ. A cell cannot travel or move around the body to go scavenging for food or to empty its trash, which means that there has to be a system-wide mechanism within the body that services the needs of each cell to ensure its survival and functionality. And this is done via the body's two main systemic fluids, blood and lymph. If you were to look at a tiny sliver of tissue under the microscope, you would see a bunch of cells separated by what's known as the interstitial spaces. These spaces are the channels that allow for transport of nutrients in and the waste out of the cells, where the blood is what feeds the cells and lymph is what cleans them. Now, once this waste is dumped into the interstitial spaces, it is then carried to the kidneys via lymphatic channels. Of course, if we're dealing with heavily toxic substances, then they're first taken to the liver, where these compounds are conjugated and converted into less hazardous chemical constituents in order for them to be safely excreted by the kidneys. Now, when our eliminative organs like kidneys and the bowel get backed up, or our liver is sluggish and cannot do its job, the body will employ alternate means of ridding itself of waste. In a healthy person, the lymphatic system is fluid and moves well. It's sort of like a conveyor belt. It's a moving mechanism. So the cells continuously toss their garbage onto it, if we're using the conveyor belt analogy, and the perpetually moving mechanism quickly and efficiently moves it out. But what happens if something makes the belt stuck and it stops moving? Well, the body doesn't stop producing trash as a result of its daily functions. So it continues throwing its garbage onto the belt. But now that the belt's movement has been halted, instead of being removed, the crap, for the lack of better word, simply keeps piling up until it starts to overflow, creating basically one hell of a mess. What also happens when you have a lot of trash laying around and rotting is that vermin move in, like rats, roaches, and maggots. Why? Because there's an abundance of food for them. And the exact same thing happens in our bodies, except instead of roaches and rats, we get viruses, bacteria, and parasites. And of course, the medical establishment blames these microbes for diseases as well as skin problems. If you have acne and you go to a dermatologist, they're going to give you antibiotics, which in the end actually creates a larger problem. Because on the one hand, you have an overflow of toxic trash that keeps piling up and isn't going anywhere, attracting all sorts of critters, which, while not pleasant, at least helps you a bit because they're eating the garbage that you're not able to eliminate. Then on the other hand, you're now killing these opportunistic organisms by introducing harmful chemicals into an already overwhelmed system. This, of course, creates additional toxic byproducts from their die-off that you still have no way of eliminating. And of course, inevitably, once you stop taking the antibiotics, or as we're using this analogy, putting the poison out for the rats and roaches, new critters come in because they can still smell food. And these new critters are smarter than the first batch because they have learned how to sidestep the mouse traps and become much more resistant to our efforts to kill them. And this is by and large how the medical community deals with what they have compartmentalized as isolated skin problems, rather than addressing them as a system-wide failure that's affecting the entire organism, and skin just being one part of it. So a dermatologist will give you creams, washes, antibiotics, even killer drugs like Accutane, but never ever address the actual cause, which is chronic lymphatic stagnation. They will tell you that you need to reduce oil production and kill bacteria because that's what causes acne, which of course is a bunch of baloney. There have been studies where they examined and compared the skin of people who get acne and who don't. What they found is that both groups had the same types of bacteria and in comparable quantities, as well as similar levels of oil production. So what gives then? Well, first what I want to say is that sebum, skin oil, has a greater significance than most people, and certainly doctors, realize. So first let's examine why the skin gets overly oily. You see, increased oil production is the body's defense against acidosis. Why? Because oil is an anti-acid. The other reason is that lymphatic system is a lipid-based system. So when stagnant lymph starts coming through the skin, it will have a fatty quality and texture to it because that's what it's made of. So what you will see as you detox the body and unload the majority of toxic waste that's been stored inside you is that your skin will stop being oily. And this is something that I personally can attest to because this happened with me. So why do some people develop acne and others don't, even though they have similar levels of sebum and bacteria? Well, it turns out that oil and bacteria only become a problem when there is an underlying inflammation present. And this is what was found in this study. So what is inflammation? Inflammation is your body's natural immune response to something that is out of balance. See, bacteria do not cause problems. Bacteria are actually the nature's janitors. They eat our waste and they break up our stagnant lymph. So when we get so backed up with toxins that we cannot eliminate because the body's eliminative channels are blocked, the bacteria will then come in to try and break it down so that it can actually come out. And you will see this with mucus. I had a friend who came to me and she said, I'm having problems with my pituitary, the doctor said so, and when they looked up my nose, they said I have a lot of mucus, but I don't feel it. And the doctor said it's because it's all dried up in there, it's dehydrated. So when the mucus is in that state, you're not going to be able to expel it. But when we get a cold, when, you know, bacteria come in and they start to break that mucus up, we can't breathe, because when you hydrate it, that mucus expands, right? So it feels like we're stuffy, and we perceive it as a negative thing because it's unpleasant and we can't breathe. But this is actually a very positive development, because now that you've hydrated this mucus enough, it can actually be expelled from the body. And this is the service that bacteria and other microorganisms do for us. But instead of being happy about it, we go and get a pill to kill them. All right, so when you pop a pimple or a cyst, you're going to see milky or clear fluid. And what is that? That's lymph, right? So mucus, oil production, pus that comes out of our pimples, that is all connected and related to the lymphatic system. By the way, the color of the expectoration that comes through the skin or through your sinuses when you expel mucus, the color of this expectoration indicates the level or degree of lymphatic stagnation. You know, a dermatologist tells you that the color of the cyst contents depends on your melanin levels. So if you're light-skinned, they say, you're going to have whitish substance in your pimples and cysts. And if your skin is dark, then you'll have dark catarrh. But if you ever watch Dr. Pimple Popper, as I do, because I have a strange fascination with pimples and blackheads, you can clearly observe that this medical theory simply does not bear out. And we see this on the show, even though she consistently repeats this falsehood, saying that the color of the cyst contents depends on the level of melanin. We actually see through her case that this is not true, because light-skinned individuals will often have brown or even black goo coming out of their skin, and dark-skinned individuals will have white or yellow stuff. So this is just another thing that doctors seem to be clueless about. But if you're familiar with the lymphatic system and how it works, then you know that there are 4 stages of lymphatic stagnation, which are clearly defined by specific colors, whether we're talking about mucus, discharge, or pimples and cysts. So these are acute, subacute, chronic, and degenerative. The first, acute, is the earliest stage. This is when the toxic event first occurs and the body responds by producing a defensive substance like mucus or cholesterol. Because remember, lymphatic system is a lipid-based system, and cholesterol is actually the body's defense mechanism against acidosis, which is another stupid thing your doctor will do, is try to lower your cholesterol rather than addressing why your body is producing increased cholesterol, which is in response to acidosis, of course. So the acute stage is going to be represented by clear or white color. And this is most clearly seen in mucus. And if this mucus hasn't been cleared and sits around for a while, it's going to start turning yellow and green, which is the subacute stage. And if we continue to acidify our body with trash that's accumulating and stagnating, our lymph will start to turn brown, meaning chronic, and then eventually black, which points to degeneration and breakdown of tissue. So the color of discharge that comes through the skin actually shows you the level of lymphatic stagnation that you're dealing with in your system. And this, of course, can vary from one part of your body to the next. So also pay attention to the areas of your body where the skin is affected, because that is where you have actually toxic waste that's not moving. Because if you have breakouts on your face, it's not because of the acids that are accumulating in your legs. It's because you're lymphatically backed up in your head, right? So there's clearly a correlation. And this is where I want to link the condition of the skin to the GI tract. You see, all of our organs and glands are directly hooked into the GI tract via lymphatic and nerve channels. And you can see this especially clearly in an iridology chart, which shows the correlation between the specific segments of our intestine and the rest of the body. And that's why toxicity of the GI tract will affect other parts of the body. So Arik, I want to bring up a picture here so people can see. Let's see if we can do this. All right. So you see this ring here where we have transverse colon, we have descending colon, we have sigmoid, small intestines, and it's on both sides. So, and then you see like the spikes of the wheel here that have different organs and body parts related to them. So if you're backed up in the small intestine here, okay, it's going to affect your forehead, upper jaw, nose, lower jaw, so the face, right? You can get breakouts on the front side of your neck, your throat, where your scapula is, your back, all right? If you're backed up in your descending colon here, you can see skin conditions come up on abdomen, arm, hand, chest, the back of your neck. You see that?
Mm-hmm.
So you see how when our colon that is literally plugged in to every single organ and gland, and you can see them on this chart, specific parts of the colon or small intestine, when they're backed up, when they are toxic, are going to then back up through the lymphatic channels into other parts of our body, as you can clearly see from this graphic. All right, so I'm gonna take this down. When you have toxicity in your GI tract, you saw the transverse colon goes into the head. So when that part of your intestine is backed up, you're going to see hair loss, you're going to see dandruff, you're going to see scalp acne, you're going to see seborrheic dermatitis. And this is important because these are the things you have to address if you ever want the chance of fixing your condition. And let me just say a couple of things about dandruff. because we see the flaking skin, it seems, right? But dandruff is not caused by dryness. Aside from stagnant lymph that is backed up in the scalp, dandruff actually has to do with fungal infestation. And that's why dandruff shampoo is often recommended by medical professionals as treatment of Tinea versicolor, which is a type of skin fungus, and it usually comes up on your back or on your arms, and it looks like spots on your skin that are lighter than your normal pigmentation. All right, so when you have that, they tell you to bathe with dandruff shampoo. So when you're dealing with dandruff, you're not just dealing with stagnant lymph, but you're dealing with fungus. And by the way, anything that makes you itchy, that gives you that rash that's itchy, has fungus in it. That's what defines fungus. Now, moles and warts are also types of fungal infestation. Dr. Morse, if you're familiar with him, says that these are basically living parasites, and especially with moles and warts, they remind me of the fungus that grows out of the trees, and it's like they have roots in your skin, and you will always find them along the lymphatic pathways where you have clusters of lymph nodes. So they'll be around, they'll sort of follow a pathway around your breast or the armpit and to the back toward the kidneys. So you can clearly see that these moles and warts will appear where your lymphatic system stagnates the most, and it's going to be close to those channels, okay? So if you have warts, moles, or any other fungal issues, with almost 100% certainty, I can tell you that you have adrenal weakness and you are not utilizing sugar properly. Now, adrenals are not the only glands that are involved in sugar utilization. Parathyroid has also been recently implicated in this, specifically in signaling to the pancreas via osteocalcin. So if you're having these issues, I would be looking at adrenals, but also the parathyroid gland due to its role in insulin production and regulation. And of course, this probably means that you're also consuming a little too much complex sugars, like grains, legumes, which is beans and peas and potatoes. Because a raw diet does not cause this. The only way fruit or raw diet could cause fungus is if you're eating fruit that's overripe and is starting to ferment, or if you're combining your foods incorrectly. So this would be combining fruits with vegetables in the same meal or the same juice, or combining melons with other types of fruit, or even, certain fruits like bananas that are starchier should not be combined with other fruits like apples or berries and so on, because you see, different fruits and vegetables have different digestive levels and different digestive time frames. So when you combine an easily digestible food like watermelon with one that requires a much longer and more involved digestive process, even let's say a banana, what you're doing, you're slowing down or even halting the digestion of the lighter food of our watermelon, which causes it to sit around and ferment. And fermentation creates alcohol, it creates sulfur, which means you're going to be gassy and bloated, and it also encourages fungal proliferation. Now, fungi of themselves produce sulfites and other mycotoxins, which contribute to itching and the sloughing off of your skin. And this is what you see with dandruff and seborrheic dermatitis. And this is why I am generally against fermented foods. You know, they're lauded as health foods, something that's very good for you. But I disagree with this. You see, when you consume fermented products, you are supplying food for the fungus and yeasts that are already living inside you. Understand that the cultures in your yogurt, even if it's a plant-based yogurt, are only good for digesting that yogurt. That's it. They provide no other benefit to the body. Now, if you're eating a lot of complex sugars, which the body cannot digest because it's not designed to digest them, then culture strains of fermented products are going to help you digest them. But the problem is that consuming fermented foods will increase the proliferation of these microorganisms, creating an army of them, and they all have to eat. So when they get hungry, they will create a craving for complex sugars, which means that you're going to be craving bread, pasta, yogurt, and so on. So my point is that if we don't eat complex sugars or carbs, then we don't need yeast to break them down for us. So the solution isn't probiotics or fermented foods. The solution is abstaining from the foods that require the help of yeast to digest them, you see? Besides, fermented food is not living food. Essentially, it's food that's going bad or spoiling. This is what happens to milk when you leave it out on the kitchen counter unrefrigerated. You will also see this when mold starts growing on an old piece of bread. And that's fermentation. Would you eat moldy bread? I would hope not. I wouldn't. So why would you want to eat other fungal foods? Mold is associated with food spoilage and plant disease. There's absolutely nothing healthy about fermented foods. Both mold and yeast are fungi. The only difference is that yeast is a single-celled organism, and fungus is when a bunch of yeast come together and create a larger organism. In other words, yeasts are nothing more than microscopic fungi. So to get rid of moles, warts, dandruff, and other fungal skin issues, you're going to have to detox and stop eating things that feed and create more fungus. Also, anything that has sulfur in it, be this sulfur drugs, be this supplements like MSM, N-acetylcysteine, even biotin, anything that has sulfur in it is going to feed fungus. Sulfur is like an aphrodisiac for fungus. So that's another thing you want to consider when you're taking supplements or medications, because these will affect your fungal load in the body. Now, aside from pimples, warts, and moles, there are also pigmentation-related disorders of the skin. Vitiligo and melasma are caused by the issues with the hypothalamus, pituitary, and the adrenal glands. So let's talk about melasma, because people have asked about this. So melasma is a type of hyperpigmentation of the skin that causes brown or dirty looking patches on the forehead, cheeks, and most commonly the upper lip, giving you the appearance of a mustache. Now, this discoloration develops slowly over time, and it is thought to be exacerbated by sun exposure, by the UV light. But melasma doesn't occur as a result of the sun. Melasma occurs as a result of an overabundance of melanocyte-stimulating hormone, which is produced by the skin, pituitary gland, and hypothalamus. Production of this hormone by the skin and the pituitary is enhanced, however, in response to sunlight. So while sun may worsen melasma, it doesn't actually cause it. This melanocyte-stimulating hormone plays a key role in producing colored pigmentation that's found in the skin, hair, and eyes. And it does this by inducing specialized skin cells called melanocytes to produce a pigment called melanin. High levels of melanocyte-stimulating hormone result in increased production of melanin, which of course causes skin to darken. What's more is that hyperpigmentation or abnormal darkening of the skin is often found in individuals who are suffering from primary adrenal insufficiency. Sometimes these people are diagnosed with the Addison's disease. You see, when adrenal glands do not produce enough cortisol, which is the stress-regulating hormone, the hypothalamus is going to stimulate the pituitary gland to release more adrenocorticotropic hormone in an attempt to stimulate the adrenal glands to produce more cortisol. But adrenocorticotropic hormone gets broken down to produce melanocyte-stimulating hormone, thus leading to hyperpigmentation of the skin. Pregnancy and birth control can elevate melanocyte-stimulating hormone levels, which will then cause hyperpigmentation of the skin. And also remember that your pituitary gland controls female hormones vis-a-vis ovaries. So any dysregulation of the pituitary function may result in hyperpigmentation due to abnormal hormonal fluctuation, even without extenuating circumstances like pregnancy or menopause. Cushing's syndrome, which is where pituitary produces excess adrenocorticotropic hormone, can also lead to hyperpigmentation. And this brings me to the so-called age or liver spots, because I believe that these belong with melasma. They're not exactly the same, but they're driven by similar processes. It was once believed that liver spots were caused by liver problems. That's why they were called that. But this theory has been since debunked and disproven. Now they know that age spots are actually caused by overactive pigment cells on skin that has had years of sun exposure. Age spots appear when melanin becomes clumped or is produced in high concentrations. So to me, it seems that melasma and age spots are related. Maybe it's just that when we talk about melasma, we think really about discolorations on the face that are larger, whereas age spots are smaller in size and can appear all over the body. But what you also need to consider is that melanin production in response to sun is a defense mechanism. The sun is acidic, the heat is acidic. So if you have a lot of backed up lymph in your skin that is damaging the skin, the body is going to produce more pigment in those areas to protect itself from the sun radiation. So this is how I see it, and this would be my explanation of it. So I'm sorry I can't give you a better one. So that's hyperpigmentation. But on the other end of the spectrum, we have a deficiency in melanocyte-stimulating hormone, which results in a lack of skin pigmentation, as well as a subsequent loss of natural protection from the UV rays. In secondary adrenal insufficiency, damage to the pituitary gland prevents the release of the aforementioned adrenocorticotropic hormone and melanocyte-stimulating hormone. And therefore, there is a reduced pigmentation of the skin. And this is when you're going to see cases of vitiligo, the so-called Michael Jackson disease, where people are losing pigment in their skin. So obviously, to address these things, you have to work on your glands, your hypothalamus, your pituitary, and your adrenals. Cosmetic intervention is not going to give you the results that you want. Not only that, you will continue to get new spots of hyperpigmentation. So it's going to be like whack-a-mole, trying to get rid of one while a new one forms. So the idea is to address the core cause. Now, I want to touch briefly on melanoma because someone in the group has asked about it. And melanoma, of course, is skin cancer. But cancerous cells are nothing more than damaged or mutated cells. Now, how do they get that way? Remember when I talked about the 4 stages of lymphatic stagnation in the interstitial spaces around the cells? And specifically the 4th and final degenerative stage, which shows up as black color in the iris, for those of you who are familiar with iridology. We are told that sun exposure causes skin cancer, but that is not entirely true. Damaged skin cells that are being strangled by systemic acids, by their own waste products. When these cells get exposed to high levels of UV radiation, it's going to mutate these cells and turn them cancerous. So once again, it's not the sun, but the existing underlying inflammation and acidosis that are the primary causes, while the sun, which is acidic, is simply a catalyst. If your skin is healthy and your body is alkaline, you're not going to have these problems. Moreover, the commercial sunblocks are actually more likely to cause cancer than prevent it, because most of them contain toxic carcinogenic ingredients like oxybenzone. I'd say you're better off using good old zinc oxide that comes without any other additives. Though the downside of zinc oxide is that it's really thick and greasy. There are some natural oils that you can try, like neem, olive, and raspberry seed oil, that are also known to offer protection from the sun. Just beware that there's a lot of fake olive oil being sold commercially. And to get protection, you need the real thing, of course. Neem oil is good, but it's really, really smelly. So I don't know how user-friendly it is. If you don't mind smelling like peanut butter and garlic, then it might work for you. And of course, if you're going to choose oils as SPF, make sure that you only use raw and organic types. The last thing I want to discuss with regard to skin is the prematurely aging, wrinkly, loose skin with stretch marks that bruises easily. Now, all these characteristics that I not so artfully just crammed into one sentence have one underlying thing in common, and that is loss of calcium. Now, you may have all of them, you may manifest only some of them. You see, when we become overly acidic, the body will attempt to restore balance by stealing calcium from its tissues in order to bring some alkaline chemistry into itself. But that's only a part of the problem, because technically the body should be able to then replace that calcium by synthesizing more of it from the food that we eat. But when one or more of the glands that are responsible for calcium utilization, such as pituitary, thyroid, or parathyroid, are down, we're not going to be able to do that. And of course, loss of calcium is also going to weaken the nails by making them either ridged or brittle, cause them to be splitting. And calcium loss will also make the hair brittle, causing it to break and split. So know that when you have skin that's wrinkly and loose, or you bruise easily, you have stretch marks, you get scarring, you scar easily, it means that one, you're too acidic, and two, you're not utilizing your calcium properly. So these are the things you need to address. Now, I'd like to mention a few other things that can wreak havoc on skin and make it worse. First is detox. All right, you're gonna say, wait, isn't detox supposed to clear up the skin? Yes, and it will eventually. However, detox is removal of toxic waste from organs and tissues that have been accumulating in the body for a long period of time. It's kind of like cleaning out a neglected home of a hoarder. So hydrating and mobilizing this old stagnant lymph when your kidney filtration is inadequate or non-existent, which it is for many people, is going to cause skin eruptions. Because remember, I said that when kidneys are not working and the bowel is backed up, the body is going to use the path of least resistance. It's going to start to push everything through the skin. And this is another reason why I would like people to exercise caution when they're using lymphatic herbs. Because if you're stirring up more lymph than the body can eliminate, there will be a spillover that's going to have to be rerouted through the skin. And understand that whatever toxins have been stagnating subcutaneously, meaning in your skin or underneath your skin, the body is going to excrete through the skin rather than the kidneys, because that is the shortest path of least resistance. And the body will always choose the most efficient way of cleaning itself. So, don't be dismayed and disappointed at the start of your healing journey when you may see your skin actually get worse. And for a while, you may also see your skin go through phases where it can be nice and clear for a period of time, followed by new outbreaks and eruptions. And this is normal, and it's bound to happen as you keep digging deeper into the body, because we detox in layers. And of course, each new layer you reach is going to bring to the surface that old stagnant crap that's been lurking around for a while. It's like when you are cleaning your house, right? So if you're just doing like light housekeeping, you straighten up the room, you vacuum, you dust, and on the surface, to the naked eye, things look tidy and clean. But when you start moving the furniture and start cleaning behind the couch or on top of the cabinets or behind the fridge, you're going to find all kinds of nasty grime that was invisible at a first glance, but was nevertheless there. So be patient and consistent, and eventually you will see this trend reversing, where the periods of clear skin will get longer and breakouts will become more rare and less aggressive. Second thing that can exacerbate an already bad skin is exercise. Oh no, another one. Why do I say this? When we exercise, we produce lactic acid. That's why you feel sore after a good workout or everything aches, right? Now, if you're not filtering, this lactic acid will only add to the toxic burden of the body, which it cannot eliminate through the kidneys. And this means that the body will then try to excrete these acids through the skin, causing boils, pimples, cysts, and so on. And third factor you need to consider is stress. First and foremost, stress is an acidic event. When we get stressed out, our adrenal glands get hit and their function is impaired. So adrenals produce neurotransmitters that regulate elimination both through the kidneys and the bowels. And if the adrenals are down, so is the elimination, which means that the body will have to get rid of the waste through the skin. Once again, causing breakouts of all kinds, acne, psoriasis, herpes, and so on. And as we already discussed, when adrenals fail to produce enough cortisol, the hypothalamus will stimulate the pituitary to make adrenocorticotropic hormone, which is going to break down into melanocyte stimulating hormone that's implicated in melasma and hyperpigmentation. And that's why you're always going to see your skin get worse during stressful times. And this is due to the role of the adrenals. Now, if you have chronic skin problems, it's very likely that you will eventually end up having hair problems. Why is that? Hair is connected to skin health because hair follicles are inside the skin. Hair grows out of the skin. When we have toxic waste backing up and stagnating in tissues, it does a couple of things. One, it restricts the flow of blood and therefore oxygen and nutrients to the hair follicles, affecting the thickness and the texture of our hair. And two, it's important to understand that this waste is acidic and corrosive. And if it sits in your skin because you can't sweat due to your weak thyroid, or because you're taking drugs that suppress expectorations, like Accutane, steroids, or antibiotics, then over time, this acidic waste is going to break down the follicles, causing hair loss. By the way, salicylic acid, which is a very popular treatment for acne, has been directly linked to hair loss, according to Dr. Jensen. Impaired circulation and certain types of chemical poisoning, like quinine or general anesthesia, can turn your hair gray. By the way, anesthesia can also cause hair loss. So if you're already dealing with stagnant lymphatic system that doesn't move or excrete waste, and then you go and have surgeries, don't be surprised if you start losing hair. It's similar to the chemo effect. When we're putting a substance in our body so acidic that it just takes the hair off. And the only way to get your hair back is to remove that which is destroying it, systemic acids and toxic chemicals. Taking remedies or applying topical elixirs is useless because you cannot regenerate tissue in an acidic environment, period. You may get a temporary bump with some potions through shear stimulation, but it's going to be short-lived. You're not going to see lasting results. The only reason people see some improvement in hair with the topical use of oils is that lipids, as we already said, are anti-acids. This is also why some people have really oily scalp. The body is overproducing oil as a defense mechanism against acids. My hair used to get so greasy that I had to wash it every single day, or I would look dirty and really gross. Now I can go 4 days without looking like a greasy mess. You know, I was losing hair for many years. And some people lose hair before they go on a detox and start fasting. And some people start losing it once they transition. You can have two different scenarios. Hair loss is connected to acidosis. So when you're overly acidic, and I was on Accutane that I mentioned, which is a really, really, really bad drug. It's so bad and its side effects that you have to sign multiple waivers in order to be on it. And I believe that the doctor that put me on it should lose her license, because this drug should never be given to anyone. You have to actually promise that if you get pregnant, you will abort the fetus. You have to sign a piece of paper in order to be able to take this drug. This is how bad it is. You have to take monthly blood tests and urine tests to keep track of your liver enzymes. So drugs like Accutane have been linked to hair loss. I know other women who have lost their hair from Accutane. What happens though is that it doesn't happen while you're taking it. It happens farther down the road. So it's difficult for people to correlate it. Now, when people go on detox, they start fasting, they change their diet to raw foods, the body starts to clean itself and it starts to rebuild and regenerate. And anything that is subpar or is made from inferior building material, your body is going to get rid of, because it wants to make everything stronger and better. And this, of course, includes hair, nails, muscle. When you start detoxing, you're going to see you're going to lose muscle. Anything that's made from inferior product, building material, your body is going to let go. So if your hair was weak, you may not even known that, but if your hair was weak prior to detox, your body's going to start dumping it because it says, this is not good enough. We can do better. So it's very common for people to start losing hair once they go into fasting, and they think that, you know, the raw diet is doing that for them, that it's making things worse. That is not the case whatsoever. The body never, ever will get rid of something that is good and sound and healthy, because the body is very intelligent and very efficient. What I also want to tell you is that your focus should not be in treating symptoms. Oh, my hair is falling out. I need to put something on my scalp. I need this shampoo. I need this potion. I need this supplement. That is not going to get you anywhere. What I experienced was that I would be on some type of product and it would give me a little bump where things would stop shedding and maybe I get some hair growth, but inevitably after a certain period of time, more hair would fall out and I would be in a worse position than I was before. So it was like swimming upstream and constantly finding yourself farther and farther down the river, despite all your efforts. I even did PRP, which is platelet-rich plasma, where they take your blood, they separate the plasma, they inject it into your scalp, which is a very painful and costly procedure, and it had minimal impact on my hair loss. I didn't start to see real results until I increased my fasting, and I really got aggressive with cleaning my GI tract. Because remember, GI tract is connected to the head. That is the lymphatic channel through which toxic waste backs up into other tissues. So your focus should be on dealing with the root causes. Now, if you want to apply oils, go ahead and do it. I think it can slow down the shedding for you because it sort of reduces the acidity of the scalp. It's not a solution, but it can sort of mitigate the loss that you're going to experience. But at the same time, whatever's going to come out is going to come out no matter what. If that hair is weak, your body's going to destroy it. It's going to shed it, whether it does it today or it does it 3 months from now. So it's up to you, you know. Also keep in mind that hair often takes the longest to get back and regenerate because the body and its intelligence prioritizes its efforts and resources. This means that as you start rebuilding your body through raw diet and fasting, the resources your body will direct to the vitally important tissues and organs, things that actually keep you alive, like the brain, heart, lungs, kidneys, liver, etc. Obviously, hair, in the grand scheme of things, is really not that important. It's not that serious, other than for our vanity. So the body will always take priority in working on more vital organs and tissues. We can all survive just fine without hair, but death will come in minutes if the heart can't pump blood. So be prepared that hair regeneration may take some time, but it does come back, I promise you. Based on what I've observed with other people taking a survey, it can take 4 to 6 years to fully restore hair, depending on the severity of your problem. I always tell people to use iridology and look at their eyes, and look specifically in the head area to see if you have radius solaris or lacuna, because this will mean that it may be harder for you specifically to regenerate both the brain and the hair, because radius solaris and lacuna point to structural weaknesses, point to increased toxicity. These are genetic weaknesses. These are things that you were born with. So you're going to have to work through a lot of stuff to overcome these things. Now, a friend of mine swears by this herbal formula for hair loss, and you can either make a tea out of this, or you can make your own tincture where you use 99 point proof organic grain alcohol. You soak your herbs for about 8 to 12 weeks, and then you strain, and then you just consume the tincture. So this formula includes horsetail, comfrey root, oat straw, and lobelia. So for a pound of horsetail, you're going to take 3/4 of a pound of comfrey root, 1/2 pound of oat straw, and 1/4 pound of lobelia. I would also recommend Dr. Morse's formulas for this, and specifically upper circulation and brain and nerve. These two formulas have shown ability to regenerate hair and help hair growth. Now, also be sure to stimulate circulation in your scalp manually by doing scalp massage daily. Okay? Don't freak out when you see hair come out, because, as I said, whatever's weak's gonna come out one way or another. It can come out today or 2 months from now, but it's gonna come out no matter what. So might as well accept it, that this is just going to happen, and trust and know that it will regenerate. Now, for me, hair regeneration didn't happen all at once, and I still didn't get my hair back. What happened for me is that about a year ago, I stopped shedding completely. I no longer have shedding where it used to come out in clumps. It was scary, and it used to do that for years and years and years. And once it stopped shedding, it started to grow back in portions or patches. So it wasn't like my hair stopped shedding and I got it all back everywhere. No, it's a gradual process. And why this is happening, because some parts of your head are draining better than others. there are some parts of your head that probably have genetic weaknesses while others don't. You're also going to see the difference between the right and the left side of your body in terms of hair growth and regeneration, as well as hair loss. Why? Because each side is serviced by its own kidney. We have two kidneys, right and left. Right kidney only drains the right side of the body. Left kidney only drains the left side of the body. This is how body removes cellular lymphatic waste. So most people, myself included, usually have one kidney that's weaker than the other. And this is where you're going to see more problems or more severe hair loss. Okay, so be aware of that. So the only meaningful thing that's going to transform your skin, hair, and nails is cellular detoxification and deep tissue regeneration. In other words, you have to clean house through raw foods, preferably fruit, and fasting. There is no miracle potion or lotion that's going to give you clear, tight, glowing skin or thick, long hair until you eliminate the crap that's breaking these things down. I do recommend herbs because they can be a great help and accelerate the process of both cleaning and regeneration. So you're going to have to open up the pathways of elimination. You're going to have to hydrate and mobilize stagnant lymph, and of course improve circulation and regenerate the glands. First order of business is always, always, always cleaning out the gut and getting kidney filtration. And then of course you also have to open up the skin. An extended juice fast of 90 days or more would do great things for your GI tract. Remember, you cannot drain the head until you've cleaned up the transverse colon, at least to some extent. And if you cannot drain the head, you cannot get your hair back, and you cannot regenerate your pituitary gland. Dry fasting for a minimum of 24-36 hours is excellent for kidney filtration. It helps to open up the kidneys to help them filter. If your kidneys aren't working, you're not detoxing. Remember that. If you're having a hard time with filtration, do take herbs like Dr. Morse's kidney formulas, or make your own, or just buy a bunch of herbs like couchgrass, juniper berry, dandelion, parsley, burdock, what else? Goldenrod, nettle, gravelroot. There are so many, and some of them are really easily accessible. Now, to open up the skin, you'll need to support the thyroid with iodine-rich kelp or bladderwrack or Irish moss, whatever you prefer. Just be careful with sea vegetables that they are not contaminated with radiation or plastics and so on. And of course, you should also be taking endocrine herbs such as hishawu, schizandra, astragalus, saw palmetto, because these are going to work on all your glands. Remember that thyroid regulates body temperature, which enables us to sweat. Because if you are hypothyroid, your thyroid is sluggish, you're not going to be able to get warm enough. That's why people who have low thyroid function usually feel cold. They have cold hands and feet, right? So you have to kick up that thyroid function so that your body can actually get its temperature up to sweat. So sweating and opening up the skin is extremely important for clearing of the skin. I recommend dry brushing. Now, I also recommend going into the sauna. Either dry sauna or steam sauna is good. And what I would do, I would dry brush before going into the sauna. And if your skin really has a hard time sweating, apply essential oils to the skin. Rub them into your skin and you will find that you will sweat better and more. Okay? Now, what I would like to mention here is that I would not be using infrared saunas. Those are no good. It is isolated radiation that heats you up from inside. We know that radiation causes cancer. So when you have a lot of acids that are strangling your cells, that are damaging them, impairing their functions, and then you apply this radiation toward them, you're going to further destroy these cells. Just like cancer happens from UV radiation, cancer will happen to those cells from infrared radiation. The difference between far infrared and full spectrum light is that full spectrum light that we get from sunlight that has the UVAs and UVBs will burn you from the outside. But the near infrared, that isolated radiation, is going to burn you from the inside. So I don't care what they say, how great it is, it makes you sweat. Please do not do it. You will only make things worse for yourself in the long run with the infrared light. Now, of course, you also have to take care of your pituitary and parathyroid. Pituitary affects all the other glands. It's like the manager, the boss. So sometimes the issue is not with the parathyroid or the thyroid, it's the pituitary that's the problem, because it's not signaling correctly. It's not managing these glands properly. You can look at your eyes, if you understand iridology, to see which glands are affected, what stage of lymphatic stagnation they're in, and then act appropriately. Have to support your adrenal glands for stress management. As we said, stress is going to affect your skin. If your adrenal glands are weak, they're not going to be able to handle stress. They can't produce cortisol. It's going to also impact the hyperpigmentation issues that you have. So it's extremely important that you support all your glands. Now, if you have any questions, you can, I don't know if you write them or you just ask them directly.
Okay, Ivana, first of all, it was fantastic. Thank you very much. It was very informative. I wanted to ask about graying hair. Could you elaborate on that?
Say that again?
About graying hair.
Yes. So graying hair has two culprits. One is lack of circulation, lack of oxygen, lack of nutrition, and two, chemical poisoning. And you will see this with people who go gray prematurely. If people go gray prematurely, like my father went gray, he was in his early 30s. This is usually chemical toxicity that is passed down genetically, because we inherit our lymphatic system from the mother. We literally take on her blood and her lymph because we're hooked in directly into her fluids while we are inside the womb, right? So quinine is known to cause gray hair. Also anesthesia. People who have weakness in their head, and by the way, I have a lot of radius solaris into my head area. So you see that you have a predisposition. That's why when some people can get cancer, can get tumors, but never lose their hair because they're not weak in that area. You understand? So you will see problems where you have inherent weaknesses because those are the areas that don't really circulate well nutrition and also don't remove toxins well. So those are the weakest links. Those are the things that are going to break down first. So people who have gray hair will probably also have a lot of lacuna or radius solaris going into their head area. I'm gonna pull up a picture here. So I wanna show you what that looks like, what I'm talking about.
Ivana, I just wanted to ask you to clarify those terms, lacuna and the second one that you mentioned.
I'm gonna show you. This is why I wanna take a picture so that you understand, because
Okay.
me saying it is not going to help anyone if you don't know what I'm talking about. So I'm going to attempt to share screen again. Let's see.
Okay.
Okay. So you see this picture?
Yes.
Okay. So you see these lines, deep lines like spokes on a wheel. Do you see them?
Yes.
All right. So these lines, and your head is right here in this area. It's between 11 and 1 o'clock. So when you have these deep lines, these deep radius solaris, these are like toxic tunnels, and you see they're emanating from the GI tract, and they're going all the way into the head. And you see this person has like this dark outside ring around the iris. This is where the skin is. So when you see this kind of a dark ring that's darker in color and consistency around the iris, this tells you that you have lymphatic stagnation of the skin. And when you have, and you see this is going to be here between 11 and 1 o'clock at the top here, the edge of iris, this is your scalp. This is where your scalp skin is. And you have all of these toxic tunnels cutting right through to it. And these toxic tunnels are emanating from the GI tract, specifically with the transverse colon, which is right here where I'm showing. So when you have these radius solaris, you already know you have genetic weaknesses. You're already predisposed to things like MS, Lou Gehrig's, Parkinson's. You have predispositions to all kinds of neurological issues. You also have skin that is down. So it's going to be harder for this person to regenerate. It's going to take longer than someone who doesn't have these. Now I'm going to close this and I'm going to bring another picture up that's going to show lacuna. Okay? All right, so here we have another picture. And once again, remember between 11 and 1 o'clock, you look at your iris as if it's the face of the clock. So now, watch the arrow. You see these petal-like shapes.
Mm-hmm.
These are called lacuna. So lacuna is where the fibers of the eye are so weak they're starting to separate. They're starting to create holes in the texture of the eye. And this is representative of weaknesses. And of course, you also see that all of these lacuna are emanating also from the GI tract, which is this area around the pupil, this sort of wavy outline. So anytime you see these types of openings, these are genetic inherent weaknesses. And you, of course, if you compare them with a chart, you will be able to relate them to specific tissues, glands, and organs. Is this clear enough for you guys? You understand?
Mm-hmm. Yes.
Okay. So, and once again, this person too has a little bit of a skin ring. You see how there's this darkened circular ring around that's darker than the rest of the eye? This is where your skin is. When you see that, you know that you're going to have skin that's backed up. And this right here is the thyroid and parathyroid. Do you see where I'm pointing?
Mm-hmm. Yes.
Look at this big lacuna, big weakness in those two glands. Another big weakness here is pituitary gland up top in the head. So this person has both the pituitary and the thyroid and parathyroid down. So have to address all three.
Mm-hmm.
So now you have problems with the skin. And usually when you see problems with the skin, you're going to have problems with thyroid, parathyroid. They just go hand in hand.
What is the first, can I ask this? The second condition is lacuna, and the first one is
lacuna. So they just have different appearance. A radius solaris is a line, okay? It's like that spoke on a wheel. A lacuna is an opening, and it usually is basically a widening of the fibers, where they normally should be tightly knit together like this. But when the integrity of the tissue is compromised, they start to come apart under pressure, right? And that also when you have a lot of lacunas, you're going to know that you have connective tissue weakness in your body. And of course, that's connected to your parathyroid gland.
And again, can you repeat the name of the, can you hear me?
Of what?
The name of the first condition, the first picture you showed us?
So the first picture showcased radia solaris. And these are not conditions, these are just markings on the iris that mean inherent toxicity. Both conditions are really related to the bowels, but radia solaris are really like toxic tunnels through which toxins flow and back up through from the gut into other areas.
Ivana, so I think we got to this subject from the subject of graying hair. So just to finish the subject of graying hair, so what will be the best answer to regenerate graying hair?
You have to detox. You have to detox the chemicals, the substances that caused it to begin with. That's one. You have to increase circulation to the head. You know, I didn't just lose my hair, I also lost my eyebrows. And when my eyebrows came back, the hairs didn't have pigment in them. So I had the hairs, but they were pigment free. So this was another clue for me that my hair loss was caused by chemical intoxication from drugs like Accutane, from having had surgery and anesthesia that compounded the weaknesses that I already was predisposed to. And also having genetic lineage, like I said, my father who went gray at 30, you can expect it. Now, I don't have any gray hair on my head, but my eyebrows came back, grew back, and they grew back with pigment-free hair. And now I have to tint them because only some of them changed. I help reverse to their color. Now, once you detox, your hair color will change, but it can take a long time because head in generally takes the longest. You have to remember, kidneys are what excretes waste. So whatever is the farthest from the kidneys is going to take the longest. That's just how it works, right? So the head is usually the last and hardest to regenerate. And also because, as I said, the body's going to prioritize. It's going to prioritize brain over your hair. Right. That's just a fact. And thank God, because who wants to be demented with a great head of hair? I mean, maybe some people do, not me.
Can I ask a question?
Sure.
You said about sunscreen lotions that they're ineffective and they're even...
They contain a lot of cancer-causing chemicals that have been actually in studies and research shown to cause skin cancer.
So what do you do? How do you protect yourself?
You can use zinc oxide. It's that old-fashioned sunscreen. Remember in the 50s and 60s, you could see like a white patch people put on their nose to protect themselves from the sun. That's zinc oxide. It comes out of the tube really thick and greasy. It doesn't spread really well. The good thing about it is that it doesn't really get absorbed because it's so thick. It has that thick consistency, and it's, compared to other things, it's really not toxic. But you know, you're gonna have to give up the lightness and transparency. You're not gonna look great when you wear it. So there's some pros and cons there. And also you can use oils. I've never used oils for sunscreen, but as I said, neem, olive oil, real organic olive oil, that's 100% olive oil, not mixed with other stuff, has been shown to have a fairly high SPF. And also raspberry seed oil has been shown to be great.
Raspberry again?
Raspberry seed.
I didn't hear you.
Raspberry seed.
Seed, okay, thank you.
Yes.
Ivana, and another question about the condition of dry skin. Dry skin that gets broken easily, especially in the cold weather, but basically dry skin, very dry skin. So what it might be caused by?
Well, think about it this way, acids. Acids are really dehydrating. So if you're really acidic, it's gonna dry you out because when things are moving, everything is hydrated. This is why we call detoxification a hydrating process. And we talk about lymph being stagnant, mucus being hardened and dried up, because this is the nature of acidic chemistry. It dries everything up. So you get flakes, but flakes are not just about dryness. Remember, we talked about that. This is also a fungal issue. Also, when people have sort of this, it almost looks like their skin is dusty. It's actually uric acid crystals that the skin is excreting. And this is why dry brushing is so good, because you're going to get rid of all that. And it's not about putting lotions on. If you're going to be dry brushing on a regular basis, you're going to see your skin improve, and it's going to feel much less dry. Because as you continually get rid of those acids, that uric acid, you're not drying out the skin so much.
In my case,
hydration is from within.
Yeah, in my case, I don't have any problems in the summer, in the hot weather, but when the temperature gets lower, then my skin gets much drier, and it gets to the point when it even breaks, and you know, the blood comes out. But in the summer, no problem.
Breaking skin is, again, weak skin. This is connective tissue weakness. This is parathyroid. But also, when things get cold, there's less humidity in the air. So we're not absorbing as much into the skin from the air. So we see it. So in the winter, I would say it's not that it gets worse. It shows you what it really is like when it's not getting that extra moisture.
Yes.
And also, thyroid is implicated when in skin dryness when you have hyperthyroidism. When thyroid is overactive, it's going to cause dry skin.
So basically, thyroid is responsible for hydration in general and skin hydration in particular?
No, thyroid is not responsible for skin hydration. Thyroid is responsible for temperature regulation through the and skin that either is going to be too hot or it's going to be too cold to sweat.
Okay.
And also consider fungus, because the flaking of the skin is also a fungal issue. That's why people with seborrheic dermatitis are going to start, they get that scaly skin, and we get the dandruff.
But then I think if it were fungus, then I would experience it all year round, not just in a particular seasons. But if I experience it just in the winter, let's say, then probably it's not fungus. I wouldn't say that. Yeah, because
everybody has fungus. It doesn't matter.
Okay.
Fungus is not dependent on the weather or temperature. And when you start to eliminate fungus, it's very unpleasant because it's going to be really itchy. And it comes out in sort of in spurts, and I will get these raised rashes, and especially on my face and my neck, that are just so itchy, and then they subside. So you're going to see these things come through the skin. Everybody has fungus. We can't live without it. If you were ever eating black sugars, you could not survive without having fungus. And you can never, ever get rid of it completely. But there are also different types of fungus.
Right.
So, you know, we want to arrive at a healthy balance. And this is why people will get fungal infections of their nails. And they keep putting ointments like Clamicil and antifungals, and the stuff keeps coming back. Why? Because it's all through you. It's systemic. It's in your lymph. And lymph is around every single cell. And that's why it's going to be in the skin. It's going to be everywhere where you have cells, where you have lymph, because it's one system. It's not like, you know, you can only get it here or there. No, because the same fluid goes into every cell just the same as blood does. So you're going to have systemic fungal loads.
Okay. Okay, friends. Does anyone else?
Can I ask one last question? Before we started all the talk, all this talking, you talked about diet. I mean, everything stems from toxins, and that's why we're all, in order to heal, we need to detox. So what do you recommend? Just fruits, raw fruits and vegetables?
Yes.
Not to
This is
have
diet is about removing obstructions, because it's not the food that does the work of detoxification and cleansing, even though some foods are better at it. It's that when we reduce the burden of digestion, we are opening up the energy for the body and space to now actually do its work, the work that it's programmed to do naturally. And fruit and raw foods are the least obstructive foods, and fruit specifically, because it also is highly electrical and it's excellent for the glands. Whereas vegetables are more for building. Vegetables are more dense than fruit. So vegetables will not detox you as well as fruit, just because they take more energy to digest and process, you see? So it's about eliminating. This is why fasting is so vital and so effective, because when we remove food and we remove water, the body is now free to do its work. Otherwise, it's always like it has one hand tied behind its back, because it has to do this and attend to that and remove this and digest and utilize, and it doesn't have enough time to actually tend to its own needs. So the diet is important, because the less obstructive the diet, the more vital and living the diet that we consume, and the less we consume in terms of quantity and calories, actually, the better the opportunity is for the body to then heal itself.
But we have to eat. I mean, in order to live.
I'm not saying you don't have to eat, but that's why I'm saying choose the food that is the least obstructive and that is not going to be cooked food. And at some point you're going to have, if you want a real deep healing, you're going to have to let go of the vegetables, at least for a while, because you need to sort of take it down a notch in terms of the digestive burden. Because as I said, vegetables are harder to process, even raw vegetables. There's still too much work involved in processing them. So if you want to get to a deeper level of healing and cleaning the body, you're going to have to go to the fruit or the juice. And you can do this in segments. You don't have to be like Arik, a full liquidarian, right? You can just do a juice fast for 100 days and then you go back to eating, you see? But in that 100 days, when you had minimal digestive processes, the body's going to get a lot done. Or like what I do when I do extended long dry fasts, where you can get a lot done in that space, and then you can go back to eating more normally when you're eating your fruits and vegetables. But to get to really deep levels of cleaning, you can't do it with vegetable. You certainly cannot do it with cooked food. You're not going to do it with grains. You're not going to do it with rice. I don't care that it's vegan. You simply are not going to be able to do it.
But then how can you, I mean, you have to live on something like rice. You can't eat it uncooked. So
sure you can. This is a belief system. This is brainwashing. This isn't a fact. We talked about this earlier. The body does not need very much. The body's caloric needs have been greatly overrepresented. The body actually needs very little. 99.9% of what you put in your body comes out the other end. The body discards it. And John Rose proved it, because John Rose was a crazy old man, but God bless him. What he did, when he would weigh everything before it went in and weigh it after it went out. And he tracked all of his bowel movements now for decades. So the body actually uses very, very, very little, minute amounts. The reason we eat so much is because we're not absorbing and utilizing things that we eat, because we're so clogged up. It's not that we need a lot, it's just that we can't get any use out of it, because the body is so bogged down that it cannot process food, it cannot digest it, it cannot absorb it, it cannot utilize it. So it's not about how much you put in, how much use you're getting out of what you're putting in.
So how much do you really have to eat? I mean, just live on juice fruit, juices of fruit? Or
look at Arik. He's looking pretty alive and well. He's been on nothing but juices and liquids for 9 months, right, Arik?
Mm-hmm. Right.
Look at Ray Maor. He's a liquidarian. He doesn't eat. And people are healthy, and you look at people who eat cooked food, meat and stuff, like they have these horrible under-eye bags and circles, and look at Arik. He looks like he's 12. It's not affecting his health. If anything, it makes you feel more vitality. It makes you feel younger, less encumbered, gives you more energy.
Right.
You know, when I was really sick, before I understood the benefits of fasting, I always felt better when I didn't eat. My symptoms would always get worse once I started eating during the day, right? When I woke up, I'd be feeling good, I'd be normal, I could go and do stuff. Once I had my first meal, however small it was, that's it, I was done. I had no more energy. You know what else happens when you sort of set your body to a much lighter diet? When I was doing all fruit and juices, and then I went and I had myself a big salad, and you could really see the difference in digestion and the energy it takes. I passed out nearly in my salad bowl. Why? Because it was so dense and it took so much energy that I had no energy left to stay awake. I literally fell asleep. I was like, I cannot believe this. I cannot keep my eyes open. It was lunchtime and I had a salad. It was all raw. It had only 3 ingredients. And yet the difference in energy it takes to digest a salad of cucumbers, avocados, and some alfalfa sprouts versus digesting a mango or a watermelon is tremendous. And you can see this, like, you literally have no energy. I passed out for a few hours.
Right.
Because this is how much energy my body had to divert to digest it. Understand that average person's energy, about 70% of it is spent on digestion and elimination. Imagine if you free that energy up by eating less or eating things that are easier to digest. Imagine if that energy is now diverted to your brain. The things you could do. So this concept is a social construct that we need to eat, and we need to eat this much. And it comes from this conditioning where, you know, in the earlier days of humankind, where food was scarce and, you know, humans were always looking for food, or there were periods in history where there were famines and people were dying from hunger, basically, and starvation. It has conditioned us that we need more. But this is not actually true.
Yeah, Arik, can I ask a question? Connie here.
Absolutely, absolutely.
Yeah, two thoughts I had. Like, you know, when I try fast and I feel, you know, okay, sometimes I feel a little bit tired and I'm looking forward to my 2 hours window, and then I consume something and I'm so excited and consume it, and then it's over, and it really feel like it doesn't bring me the happiness. You know what I'm saying? Like, right. I'm even like, I mean, yeah, I ate something because I was so excited, because it's like, okay, that's the end. Like, that's what I'm looking forward during the day, you know, like something like that. And then I consume it. I'm like, well, it was not really worth to be excited about it. It didn't really feel, it didn't make me energized.
Right.
Ivana, the question that I had for you is, in regards of not eating and detoxing and healing is, for me, it's really hard with my stuff is finding the fine line between, okay, I don't want to go in a deep healing journey, because I can't deal right now with all the healing crises too much. But I obviously I want, but I can't deal with it. So for me, it's like, you know, my stuff that is going on. So yeah, it's for me hard to find the path. I don't know how to express it.
Sure. Well, the way I do it, I can't. be on this fruit like for long term. This is why I like to take chunks of time where I go really deep and really intense, where I'll go for 7-9 days without food and water and get a lot done. And then I go back to the more normal way of being. I'm still eating raw, but I'll have, you know, my avocado. I'll have some veggie fruits rather than all fruit.
Mm-hmm.
So it's about finding what works for you.
Mm-hmm.
Because when, you know, it's better for me this way. It's easier psychologically and emotionally for me, because I know that this time I can strap myself in and I can go full bore, completely focused for this amount of time. And then I can let go a little bit.
Mm.
That doesn't mean that I go off and start eating cooked food and you know, dead food and animal products. No. But it means that you're not as intensely focused. You're not as strict.
I think one that makes sense. I think the specific question is, you know, especially cleaning out the colon. So, you know, we talked about, and I think you've mentioned in one of your videos, if you really want to dig deep,
Yes.
you know, and getting the stuff out of the colon, you have to, and that's what I'm struggling, you have to choose fast 3-4 weeks, you know, or 5, you know.
No.
Okay.
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 Because like I said, all of that waste is dehydrated. So you're not going to be moving it out right away. It took me 32 days on a juice fast before I actually started moving old hardened waste out. That's how long it took for me to hydrate, to even get started. So the first 32 days, we're just warming up. This is just prep. So if you go on a juice fast for a week, you're not getting very far.
Yeah.
You see what I'm saying? So if you're going to do it like that, then it's going to take you years. This is why people get disappointed and disillusioned, because they're doing the bare minimum and they don't understand how big of a job it really is to get the GI tract clean. I watched one guy who was on a juice fast. It took him 115 days to start releasing stuff from his diverticulums. There's another guy that was on a juice fast for 6 months and he still had stuff coming out of him. So he broke it before he finished, because usually the common sense knowledge is that you stay in a juice fast until you stop eliminating old fecal matter. And he didn't stop in after 6 months, but he goes, I need to stop this for at least take a break, because it's getting a little too much for me. And you can do that, but you have to be realistic about what it actually takes. I mean, I laugh. I fall off my chair laughing when people talk to me how they went on a juice fast for 2 days and they think that they've detoxed and they're now super healthy. They have no idea. They don't have a clue.
Yeah, I think it's so interesting psychologically what I've been dealing with, like, the past 2 weeks of the tri-fast, which is amazing. Then I have a this small window, and I just have like a small like fruits or salad. It's really small because I can't eat anyway a lot, and I'm really fine and satisfying. But just giving up this small little thing, and instead of choosing it because I want to go on this long juice fast, like let's say a month or something, this small thing is so difficult, like I don't even know, it's just, I have so much respect for all of you.
I don't understand. Why is it difficult? What is difficult? Can you explain that?
I think, like this chewing is, it's comfort. Or I don't know. It's just, I
That's
don't.
conditioning. Do you see that as emotional attachment?
Yeah.
This is
100% only
emotional. Redefine the situation. People who suffer on detox journey, people who feel like they're giving a lot of stuff up, are the people who are thinking about this as something they're going to do short term, something that they need to sort of suffer through before they can get back to their old, comfortable, fulfilling life. eating foods that they used to eat. You have to shift your perspective, how you think about this. If you think about it that way, then you're going to suffer through your detox, because you're going to be thinking about this something, oh my God, how soon is this over? How much more of this do I have to go before I can go back to that which I find comforting and pleasing and fulfilling? So this is where the problem is. If you close the door to that life where you said, this is a different lifestyle, I am different now. This is about raising my vibration. This is about becoming a different person. It's just about becoming a human 2.0, 5-dimensional matrix, energy body human. When I was on my 9-day dry fast, and when I had some sort of difficulty, I've been working with these energetic accelerators that are for 5D reconfiguration of the body. And I would just tell myself, I would catch myself and I tell myself, wait, I am a 5D human. I don't need food. A 5D body does not need food or water. And you know what? Just psychologically shifting that would take away my cravings and my thirst right away, because most of it is habitual. Most of it is something that's been conditioned into us, that we're supposed to be hungry, we're supposed to eat, we're supposed to want to eat or drink.
Ivana, but just for people who are watching who might be not familiar with this term 5D body, could you just explain it in few words?
All right, so our plane of reality is defined by certain frequencies, right? So they're arbitrarily sort of delineated into 3-dimensional frequency, where things are more dense, they're slower, they're heavier, versus things that become lighter vibrationally once we move up the ladder of this vibrational frequency. So when we go from 3D to 5D, which is the next step, our body becomes lighter. I like to bring this example where a channeled being, Bashar, said that if a modern day human was teleported 300 years back in time to people in that timeline, modern humans would appear as light beings. Why? Because there's a vibrational difference between these time periods, where the physical body actually underwent such a transformation that 300 years later, it's actually much less dense. So if we were to compare side by side the two bodies, one would be really dense and maybe we would see it as sort of deformed or really not well proportioned, compared to the modern human, who is better developed, lighter, thinner, taller, and so on, right? So this is the difference. And the vibrational frequency that we occupy is, of course, you're going to manifest a specific type of vehicle that's appropriate for that frequency. The higher the frequency, the less dense the body that you're going to use to manifest through that frequency. My goal is to transition to the 5D frequency, which is where we have heightened psychic abilities, we have greater brain capacity, we're lighter, we're more connected to source, to spirit, we're less physical, we're less animalistic, we're more expanded mentally, there's more empathy. So of course that type of spiritual mindset and the type of vibrational frequency is going to require a different type of body. So this is a natural progression. So I would tell myself, I am a 5D human, which means I no longer need food or water. And the more we evolve on, up this vibrational scale, we get to the point where the body no longer needs to eat or drink. The body consumes energy directly from the universe, because we no longer have the body that's as dense, right? Because now it's porous energetically. It doesn't need to consume second and third hand energy.
Right.
That's produced by a plant or an animal or something else.
That's right. Okay, friends, I think we are going to finish for today.
Okay.
Yeah. Okay, Ivana, so thank you so much for this amazing and informative webinar. I especially liked the combination of theory and practical examples, lots of tips, what we can do according to those theories. So it's just amazing. And hopefully we'll meet in our future webinars. And you viewers, if you are still not in the fasting group, and if this idea appeals to you to fast once a week between 24 and 36 hours, you are welcome to join. You are welcome to send your name to the WhatsApp number below this video, and I will happily add you there. So thank you very much. Thank you, Ivana.
It was fascinating.
Thank you, Eric.
Fascinating. Thank you very much.
Thank you, friends. Happy fasting. Bye-bye. Bye.